They do love soldiers and Marines and their families, and they are absolutely committed to pushing us along at every opportunity. But they don't care. They're not motivated by scientific awards and prizes. They're not motivated by large infrastructure that to address these complex problems. They are motivated by things that can help soldiers and their family members, and Marines and their family members soon. And so we always keep that in mind at the Medical Research and Material Command, whether it be a firm or one of the other programs. And we're trying to find some things we can actually get through full FDA approval. And I'll talk to you about one or two of those in just a minute. The second mission is to provide cutting-edge medical capabilities to heal and resettle warriors who have catastrophic traumatic injuries and disabilities. Our market potential for our patient population, for those of you that think about the business of regenerative medicine, is probably modest. Compared to diabetes, heart disease, dementia, degenerative joint disease, and some of the other things that have been talked about in this conference or will be talked about. We simply have a very important patient population. And that's what we found out at Walter Reed and via the Washington Post in 2007. In March 2008, the U.S. Army Medical Research and Material Command, in partnership with the Navy, Air Force, Veterans Health Administration, and National Institutes of Health, established the Armed Forces Institute for Regenerative Medicine with $100 million total funding. The strategy to use combination investment, assemble a group of the best scientists in the field to rapidly translate regenerative medicine capabilities to our wounded warriors was at the core of that effort. The success of this program has attracted additional funding from Defense Health Program and the Joint Improvised Explosive Device Defeat Organization, partnering with the Department of Defense's Office of Technology Transition. So we got an additional $25 million from them. Many of the partners in the firm brought their own skin to the game, and so the firm currently has an investment of over $300 million because of matching funds from state governments, universities, philanthropic organizations, and pre-existing research projects related to the AFFIRM mission. Many of these projects have funding from the National Institutes of Health, the Defense Health Program of the National Science Foundation, and congressional lands. Moving forward, we have requested $35 million per year over the next 5 years. There's been a lot talked about multidisciplinary work, and this is just our fancy word for multidisciplinary work or convergent science. We're not going to dwell on this slide very much. For us, it's not about stem cells. It's not about transplants. It's not about tissue engineering. It's about regeneration. It's about what combination of those things give the young men and women who have gone into harm's way and been injured severely, what give them the best functional and anatomic results. The scientists performing the work we fund are using different approaches for regenerative therapies. They use bioreactors, growth factors, scaffolds, devices, and cells, including stem cells, to tackle the task. They are developing novel immunomodulation therapies for tissue cell transplantation. And again, it's not about stem cells per se, it's about regeneration of structure and function by whatever means. The picture at the top left shows the scaffold approach. The middle left shows adult stem cells, and the bottom shows near mold, which can be coated with cells. The right top is our chimeric rat with induced immunity to the donor tissue. The middle is, it represents curcumin spice, which found in Indian curry for burn and scar treatment. And the bottom is then the picture represents a bioactive material. This is a partnership. We have industry partners, we have joint partners and the other services, we have interagency partners, we have partners with academic institutes, and I've already alluded to the commercial partners. Sometimes we have so many partners, I think we're being promiscuous, but we prefer the word ubiquitous. Translation research is a team effort. We can share our expertise in product development, marketing, regulatory affairs, and manufacturing. We can share resources for clinical trials. And we can work together to license technologies and seek the additional financial investment it will take to get these into the marketplace. Studies focus on questions of interest to the military, but most of the products have commercial application. They provide a mechanism to advance combat casualty care, and as I said, advances improve both civilian and military